Hi, I'm Dr. Sarah Lai, and I'm a specialist in pediatric dentistry.
Hello, Dr. Lai. What are we going to discuss today?
We are going to be talking about dental decay in children.
Dental caries is a major concern for many parents, especially when multiple cavities are found in their child's mouth. There's also a common myth about cavities in baby teeth, that they don't matter because these teeth will eventually fall out. But is that really true?
That is definitely not true. Primary teeth are very important in the child's mouth as it overall affects the development of the child. If you have dental caries in primary teeth, it increases the risk of you having dental caries in permanent teeth as well. So it's very important to keep all the teeth clean so that it leads to a good permanent dentition when the teeth change in the future. Baby teeth are very important because they act as a template for permanent teeth to erupt. So if the teeth are lost due to dental decay at an early stage, you will lose space in the dentition, and that might lead to insufficient space for the permanent teeth to erupt properly in the mouth in the future. Dental decay can also cause pain and discomfort in the child's mouth, and this could greatly affect the child's daily life as well. And as the decay gets worse, it could cause swelling and extreme pain, and this might lead to swelling of the face as well. And this is what we call an infection, and if not treated quickly, might also affect the developing permanent teeth. So dental caries is caused by cariogenic bacteria in the mouth, and if it's not eliminated regularly, and there are too much bacteria in the mouth, it would start to cause the teeth to form dental caries. So some factors might include eating a lot of genic foods, which include sugars, sugary drinks, or starchy food, and also factors such as not brushing adequately or removing food substances in the mouth regularly might also cause dental caries. Eating very frequently or snacking very frequently would also cause the pH of the teeth to be consistently low, and this would also cause dental caries very easily. One of the common reasons we see dental caries in children is also that the child tends to like to drink formula milk from the bottle, especially to sleep. So one way that we could prevent that would be to brush the teeth after drinking the milk right before sleeping, and not to let the child drink the milk to sleep. Of course, we also understand that kids are persistently hungry and like to snack a lot. So one way would also be to try to reduce sugary snacks and replace sugary snacks with low sugar snacks or maybe more savory snacks instead. And also to try to have scheduled snack times rather than to have spontaneous snack times during the day. It is very common to see children with dental decay because the anatomy of the child's tooth is slightly different from the permanent tooth. The enamel is very thin, and therefore when the decay enters the tooth, it spreads very quickly, not just within the tooth. It will also spread to other teeth in the mouth. And therefore in a child, by the time they come to see us, very often they actually have more than one tooth with decay, and very often many teeth with decay. And it's very important that we try to restore all these teeth, because if they continue, the decay will spread very quickly and enter the nerve, and that will in turn start to cause a lot of pain and discomfort for the child. This is a case of a child who has multiple decay, and some of the decay has already entered the nerve, and this would necessitate root canal treatment as well as a crown. Sometimes if the tooth cannot be restored, we would have to end up extracting the tooth. It's very important to know that caries is actually a disease. So we have to look at dental caries very holistically. We do not look at just treatment itself, but I think first and foremost, we have to look at preventing caries. And one way would be to change certain habits at home. And so first thing that we would do in the clinic is to find out what are certain habits at home that are causing the decay. And straight away, we'll give you advice on what to do and what to change at home. And some of these positive changes could be brushing your teeth very regularly and using age-appropriate toothpaste, which might progress as well as prevent new caries. And it might also include some dietary advice, which might include less sugary foods or decreasing the frequency of eating. We might also apply high concentrated fluoride on the teeth to prevent the progression of the disease. So oral hygiene at home is very important because that is the foundation to preventing decay. This is a clip of oral hygiene at home. So toothbrushing is very important at home. The parent is using a smear of age-appropriate toothpaste advised by the dentist to brush the child's teeth. It's also important to note that the child might actually be quite resistant to brushing the teeth, but it's actually very important to do this regularly so that it becomes a habit for the child. Do also note that oral hygiene practices are also individually tailored based on caries risk of your child. So we will discuss in the clinic how much toothpaste to use, as well as how to brush the teeth, and as well as when to brush the teeth. As for management of the teeth, there are many ways to manage teeth with dental decay. We have more conservative methods, such as just simple fillings if the cavities are shallow. As the cavities become deeper, then we might have to consider larger fillings. Or if unfortunately they are very close, if the decay has already entered the pulp, we might have to consider a form of pulp treatment, which is what most of you would know as root canal treatment. In primary teeth, there are two different types of pulp treatment, and one is called a pulpotomy and one is called a pulpectomy. So depending on the severity of the tooth decay, we might be able to do a pulpotomy, which is what we call a partial root canal treatment. So it only removes the infected and inflamed part of the nerve or the pulp, leaving behind healthy nerve in the tooth. So that would be more ideal. However, if the entire nerve is infected, then we would have to do a root canal treatment, and that would mean removing the entire nerve from the tooth. After pulp treatment has been done, we would have to place a crown on the tooth. And typically this is stainless steel. Increasingly, there have been some tooth-colored options, but stainless steel crowns are usually more popular and can last longer. Ultimately, these treatment options are determined also not only clinically based on what we see on the tooth, but also radiographically. We would have to take radiographs to confirm if the teeth can be restored. Sometimes if the infection has spread all the way to the nerve and to the roots of the teeth, and if the roots have been quite badly affected, we might not be able to save the tooth, and we might have to extract the tooth as a last resort. However, extracting the tooth might have certain implications, such as space loss, especially if we extract the primary molars of the teeth. If they are extracted too early, then as the first permanent molar erupts into the mouth, they might migrate towards the front if there is a space. So one way to prevent the space loss after an extraction would be to fabricate a space maintainer for the child, and that can be fabricated in the lab, or it can also be done in the clinic. It also depends on how many dental cavities there are in the mouth, and also depends on the behavior of the child. So we would have to look at the treatment plan and then discuss with the parent on how many visits will be required, as well as how many teeth will need to be restored. And we also have to assess whether the child would be cooperative enough to have treatment done while awake under local anesthesia. If that's not possible, then we might have to consider other options such as sedation, and that is when the child is asleep under the care of the anesthetist, and we will then do full mouth rehabilitation and restore all the teeth in one sitting when the child is asleep. In conclusion, I would advise every parent to bring your child to see the dentist regularly for checkups, because initial dental decay is quite often not noticed by the parent. And if the dentist can detect this early enough before the dental decay gets worse and starts causing pain. Hope the sharing today is useful. Hope you can start with good dental habits at home, and thank you for listening.